Okay, we are live. Hi, this is Erin Morgan. I am the editor-in-chief of Eye Care Business Magazine, and we are here today for the next session of our Eye Care Business COVID-19 strategy series, which has been going on for about 4 weeks now, and we've had just really fantastic response. So thank you all for joining us and for tuning into all of those. And today we are super excited to be here with Tom Burke, who is the CEO of ABB Optical. And welcome to you, Tom. Thank you so much for joining us today.
Hi, Erin. Thank you. I'm looking forward to the next hour. Thanks for having me.
Yes, I know. I'm very excited to have you here. And I think we're going to have some real good information for our viewers and for our readers of Eye Care Business, who I know are really looking for that information right now on how to succeed, how to move their business forward in this super challenging time, and what the new normal is going to look like for them. So we know these are challenging times for your business, so we're trying to provide as much information and expert opinions as we can. So we appreciate you joining us and tuning in to learn a little bit each week. So just give a little bit of background on Tom. Tom has an incredible wealth of experience that he brings to the industry. Tom, you've been with ABB now for almost 2 years. You joined in August 2018 as CEO.
Yeah, amazing.
Yeah, and time flies.
Yeah, for sure.
Yeah. So, and you came from you were outside of the optical industry previously, and you came from Massachusetts-based Medical Specialties Distributors. You were there for some time, and then also as VP and General Manager of Specialty Distribution Division of Cardinal Health. And you held other positions there as well, and you were also CEO and President of Miami-based Novus Pharmaceuticals. So it sounds like but you live in Boston, is that correct? And you kind of have worked all over.
Yeah, so Boston's home. Of course, I love Boston. Home is where your family's at, so that's my special spot. But across all the experiences, Erin, there is a common platform to all of those. It sounds like when you think about my Cardinal Health experience for 30 plus years, and then Novus, and then MSD, and now ABB, the common platform is healthcare and healthcare distribution, and it's what really my passion is. It's around making sure there's a higher purpose here, that we're in healthcare, and there's a critical part of it, which is distribution, and that's really been my foundation my entire career.
That's fantastic. Well, it's great we always love to have an outside perspective brought into the industry as well. Even, you are definitely healthcare related, but it's nice to have, kind of dimensional perspectives. And we have a lot of that in our market, which we're very fortunate to have. So that's great. So can you just tell us a little bit about, for our viewers and our readers that may not know as much about ABB, can you tell us a little bit about what ABB does, and then also kind of what your focus is there, that you're focusing on since you've been CEO for the last 2 years?
Yeah, so ABB is a company that really began in the late 1980s. It was founded by a gentleman by the name of Angel Alvarez, and many of the folks that are in the industry know Angel really well. Such a gentleman, and really ahead of his time when you think about the role and the business he created here in the optical space. ABB's existence since the late 1980s really has been to be the friend of the independent eye care practitioner, where we were in a bunch of businesses. So it was contact lens distribution and specialty contact lens manufacturing. Then over the years, that was the that was the foundation of the business that Angel started. Right. By the way, Angel is still on my board. He's the chairman of my board today. He's a great mentor and friend of mine, and so he's still very active in the business.
That's great to hear. I know he's a wonderful person. I know Angel, and he's very highly respected in the industry, no question.
Yeah, amazing. He's a mentor, he's a friend, he's a confidant, he's all that to me, and I have such a high degree of respect for Angel. And so when Angel started on this journey, It really began as a contact lens distributor, and then it grew into a specialty manufacturer. And then from there, he made some investments, and we get into the data and analytics business and the lab business, and manufacturing of lenses, and then the spectacle distribution business. And so over the course of the last let's just say 35 years, it grew into the business that it is today. And what I would tell you is that we're in really three different businesses, Aaron. We're definitely still deeply entrenched in the contact lens distribution business. We have this amazing lab business where we manufacture the lenses for spectacles, and just growing and really an essential business for us. Just a beautiful business. And then the one that I think we've hid behind for years that we really brought to life over the last year and a half, and we'll spend some time talking about today, is our solutions business. And of course, Angel was always in this business. We owned data and analytics companies. We owned a GPO. There was continuing education, focus and resources for the IECP, but we really never came to market with it. It was always stuff that sat behind the scenes. And recently, we've made a very conscious effort to bring that product to market as well.
That's fantastic, and that is very noticeable. To us from the press perspective with the media and seeing, what you folks are doing, and we love to share that because there's a lot of education that ABB, you really can see there's a passion for assisting the ECP and providing education opportunities all over the country, really. I know you have different series and sessions that you've run as well at ABB. So thank you for doing that.
Yeah, thank you. This is, you'll hear me say 100 times over this hour that there's such a passion from our employee base around the doctor and the community, and that this is healthcare, not just consumerism. And we have a frustration inside our four walls at ABB, which is literally everybody in this industry is trying to take the doctor's patient, and they're trying to make it either fashion or consumerism. And it's healthcare. It's darn healthcare. And so our intention, of course, is to put our best foot forward every way we can to support that doctor in the community.
That's fantastic. Well, especially now, it's even more critical than ever, given the current circumstances. And so I just want to tell our viewers that we'll head into some questions that we kind of set up with, that I wanted to ask Tom today, and kind of focusing on moving practices forward, strategies for, how to navigate the new normal. But we will also have some time at the end of the session for your questions. You can feel free to please just type your questions into the comment bar into Facebook or YouTube. We've had great response from folks as they're watching. So I see a lot of you out there. And please feel free to just even tell us who you are, what your name is, what your business name is, what your practice is, or where you're from. And we'll give you a shout out as we move along here. But we've been really enjoying having a kind of a great back and forth with our attendees. So feel free to start posting comments as we go, and feel free to ask questions as we move along. We'll have a dedicated time at the end, but we can also address things that are kind of really relevant to what we're talking about in the moment as we move through our conversation. So we'll head into kind of this lineup of critical questions for Tom. Well, first of all, you have a really kind of a good bird's eye view, Tom, at ABB, because you have a lot of customers that are eye care professionals all around the country. So, can you tell us a little bit about what ABB, so first, maybe just the status at ABB. Is your lab, I know you have lab operations, are you still fulfilling lab orders for customers? What's the status of contact lens fulfillment, things like that during the crisis?
Yeah, so ABB really goes by the way of the doctor, right? And so unlike a lot of the businesses in the optical space, when the doctor's offices shut down, it really affects ABB. So just a reference point, we have about 7 out of 10 doctors in the United States of America buy their contact lenses from ABB. So we've got a huge market share across the United States. The lab business is certainly less than that. So it's, again, one of the reasons why that independent doctors, there's such a high passion and such a high connectivity to us and them. Our business really is, we're a mirror image of each other. That said, specifically though, our contact lens distribution business is fully operational today and has been throughout the entire crisis. Our lab business is fully operational and has been throughout the entire crisis. And our solutions business, is really going great. I know that, you and I have talked about that business, and that's really going well for us. We, in full transparency, Aaron, we were going to release a lot of this stuff at Vision Expo East this year,
right?
As business solutions that would be options for doctors across the United States to use and redeploy in their practices. And because of this crisis, Vision Expo canceled, and because of this crisis, we made a very conscious decision to bring all this stuff to market at no incremental charge. And that wasn't, again, in full transparency, that wasn't the original intention. Right. But the world changed right in front of us, and we really had to show up in a different way, and that's what we did.
That's fantastic. Well, that actually kind of, leads to another question I had for a little bit later, but, ABB has really developed an excellent offering of resources for ECPs during this, it was, as you said, mentioned that some of them were in development before. You've also kind of, developed a lot for the crisis. Can you just tell us a little bit about, I know ABB has a virtual resource center now on their website. What are some of the different things that are available?
Yeah, so I want to preface this. I love doing these because I fall in love with this industry so much, but I don't want these to be, ABB infomercials. I want these to just have passion around the doctor and the community, and how do we get restarted again, and how do we do the right things for you, and my business will follow that. So I'm going to answer your question, but I'm going to answer it in a funny way. I think the first thing I'm going to say is that as the doctors, come back and recover, they should find partners that help them bring solutions to their business that they can't do individually. So today, they're competing with big, huge companies with tremendous resources and tremendous finances to back them up. And then you've got 43,000 doctors out there that are trying to do this one office at a time. And that's really dangerous. It's really dangerous because, up till, 30 days ago, if I talked to most doctors' practices about telemedicine, or if I talked to most doctors' practices about direct-to-patient strategies or subscription models or auto ship plans or data and analytics, or proactive verification of benefits, or these are all the things that we have been spending the last year and a half building out that are actively and readily available today through ABB. But when I brought these discussions to the market 60 days ago, there was lukewarm. It was, I know I need that stuff, but we just got punched in the face. 43,000 doctors just got their business shut down. Right now, we've got everybody competing with them. We've got the online companies that are trying to compete with them. You've got a lot of direct-to-consumer companies trying to compete with them. And now all of a sudden they're shut down, and they don't have direct-to-patient strategies, or they don't have a good data and analytics strategy, or they don't have an auto ship or a subscription model strategy. And these are essential right now. And so those are the things that we've spent tons of money and tons of resources behind under, Erica Jurens, and I've got this amazing marketing and strategy team that have put a ton of work for the last year and a half building this stuff out that we've now come to market with. So yeah, we've got all those things, and I'm happy to go to any detail, any one of those you want, but rather than make that an infomercial, here would be my wish to all the doctors out there. Whether you partner with ABB or not, that's okay. But who you should be partnering with is someone who's not trying to convert your patient into their consumer. And if they're trying to convert your patient into their consumer, you should now use this as your wake-up call to say, wow, am I going to lose that patient? If I give up my data, if I give up my practice, if I let that patient go elsewhere, if I don't really start to proactively with patient communications, what's going to happen to that revenue down the path here, right? So doesn't have to be ABB, right? Now, of course, I'm really proud of ABB and what we've done. Why wouldn't I be? But this isn't just about ABB. Pick your friend, pick your partner, and as you reshape your strategy, just go to market and protect that patient.
Such fantastic information, and I do appreciate that. And I don't want it to come across as an infomercial, but I do think that you do have some fantastic resources. So if folks do want to check out what you have, they can go to the ABB Optical website to see what's there and available for them, for sure, as resources. So I'm going to do a super quick, we're getting a ton of comments in here, and I'm going to do a couple of quick shout outs, and then we'll head into a little bit more strategy questions for Tom. But first I have Onno Ruick, who is an optometrist in the Netherlands. Hi, Onno. I hope I'm pronouncing your name correctly. I know we had someone from Nigeria that joined us on our panel last week as a viewer, which was fantastic. So we're getting all over the world. I see Carla William, who is an optician. She says, hi, Carla, optician craftsman from France. So we have France tuning in. We also have Amy Jansen Barker. Hi, Amy. She said she's from Lifetime Eye Care in Spearfish, South Dakota. Then we also have, hi, Onno. Onno said hello again. And then we have Miguel Pinzon, Digital Transformation Advisor with Oracle. So checking out our industry. Welcome, Miguel. And we also have a question here. So Brian Schuler, who I know as well, he says, hi, Tom. Brian Schuler with Wallman here. Great to see you looking well. What are you hearing from practices on their reopening expectation and plans? Which is a great question, which is something we had wanted to talk about. So you have a lot of customers, you're hearing from folks. What are you hearing from the market?
Yeah. So hi, Brian. Thanks for the question. The big question for everybody is when, right? And then the real big question is how, right? So when we reopen, what's that new flow going to look like, and how's the optical industry going to change inside those businesses? I guess let me answer the when first. Wouldn't it be nice if we knew the answer to that question? I do believe, though, that we are in an essential role. I believe all those doctors and nurses and firefighters and police officers and the men and women doing all this great stuff out there really need our help, and they need the opticians, and they need us in this industry. And so I believe that we'll be one of the first industries back in full steam. Of course, we are still back today. We are still active today for emergency care. But I really do believe we'll be one of the first businesses that come back to work sooner rather than later. And I hope that's in the next 30 days or so. I know there's a lot of companies and a lot of offices and a lot of states starting to open up now. There's certainly tons of offices that are proactively starting to do business from their homes. That's, I'll give you just a fun stat. Our direct-to-patient shipments, we've shipped over 500,000 direct-to-patient orders in the last 30 days, right? So there's a lot of offices out there that are active. There's a lot of offices out there that are really focused on their patients. So I would say next 30 days, we should start to see things start to come back. I do think that the contact lens business will come back slower for all of you than the lab business. I think in the case of Wallman and all the great work that you all do there, I think that'll come back quicker. I think there's a lot of people that are, hopefully waiting to come see their doctor and waiting to order their glasses, where I'm not sure that necessarily is the case for the contact lens business. And that should concern all of you. We shouldn't let people just come in and steal that patient in that contact lens space. But then I'll transition to the how. The how here is going to be really tricky. And I think that facts are going to matter. I think data and analytics are going to play out more than they ever have before. I think flow, whether, you're talking about wearing masks or setting appointments, and what's that flow, and what are you going to do with your office staff, and how are you going to ensure not only that great patient experience that they fully expect through the Amazons of the world, and now through the people who are trying to steal that business. They're going to expect online ordering. They're going to expect, web pages that aren't out there before, patient communications that aren't out there, cleanliness and on-time appointments, and direct-to-patient shipments and subscription models. And so I hope and I suspect that the doctors out there today are working really hard to refresh their strategy and then organizing around that. So when the doors open, they're ready. They're ready. And I got to put a plug in for Wallman since he asked the first question. You guys are one of those few companies that don't compete with those doctors. So thank you for that. You guys do amazing work.
That's great. Great insight. Thank you, Tom. And thanks for asking that question, Brian. We appreciate it. We love all this back and forth. We have a lot more folks telling us that they're tuning in. We have Ojeki, and I'm so sorry if I'm not pronouncing it right there, but I think you had joined us last week, Nwokidi from Lagos, Nigeria. And thank you for joining us again. We also have Sumit Dutta from India, South Andries Berger from South Africa. We've got like a really global audience here, which is super cool. We have Abby Ayub, great content. She's thanking us. Abby from the Optical Academy. And then we have an optometrist, Anisha Patel from Deptford, New Jersey. And we also, and I see Elise Briscoe. Hi, Elise. I know Elise very well. She's an OD, also in our industry. She has a question for you, Tom. She says, do you think that online refractions and eye exams will come sooner now that so many services and retail are shifting online, which is a fantastic question.
Yeah, that's a great question. I have to put a plug, Aaron. I'm looking over here in the comments and who's joining. I see one that says Grams Burke, which is my mother, right? I mean, come on. How do I not put a plug in for my mother, right?
Hello, Mom.
So 91 and going strong. Right. So
wow, that's awesome.
Yep. So let me come back to the online refraction. So this is one of those subjects that I think is going to be essential for all of us, when we do get back in business. And I do believe that now more than ever, we need a solution that should protect the independent eye care practitioner. That should be an online refraction where that doctor can be tied to that and can perform all these things that these third parties are trying to do. We have to do it on behalf of the eye doctors. This is a convenience that's going to live. It's going to work. It's going to be real. Whether you all want to embrace this or not, it's out there. And we need to, meaning me with you, need to have a solution, me or anybody you partner with you, that needs to have a solution where online refractions is an option for that patient. And, I'm going to sell a future here. I'm knocking at the door to be able to bring that to the market on behalf of the eye care doctors. So if things go great in the next 30 or 60 days, hopefully sooner, we will have an online refraction opportunity that's one of our business solutions to bring to the market. And there's foundationally something you should always, always, always believe if ABB is bringing it to the market. I will never bring this to the market unless it goes through you, unless you benefit. Right. So the companies that want to bring an online refraction, let's not forget this starts with a prescription. Let's not forget this is a patient. Let's not forget that this is healthcare. And so if you want to steal the patient after the exam, or if you want to steal the patient and make them your retailer, good luck, but not under my umbrella. Right. This is why I believe that the IECPs, we've got to wake up here. Right. We've got to make sure that this punch in the face. For us, we said, okay, we get it now. Our business just got a big step backwards. So now we are going to embrace subscription models. Now we are going to embrace online refractions. Now we are going to embrace data and analytics. Now we are going to, go to market like a big business would. And I'm going to partner with someone like an ABB or a Wallman or somebody else out there that darn cares about us, right? That's where I hope this thing goes in the next 30 days. That's a big ask too, because I'll give you just a little personal frustration is that there's 43,000 of you, and you all want to act like one office at a time. And meanwhile, the big companies are just crushing you, right? And I think it's too late. I don't think it's too late. I think it's now for us to start acting like a big company, or otherwise these big companies are going to just steal your patient.
Right. It's now is a time to be stronger together for sure, and to partner, no doubt. And we're seeing, a lot of folks, and I think there was a lot of fear in this situation as well, because there are so many independents out there and they're all on their own island. And when you're on your own island and you have this kind of crisis hit, it's very frightening. And
Yep.
we've heard it over and over and over again from our readers. So to, kind of look at this, and I'll just tell you, we've done an eye care business. We just deployed this morning our third wave of our COVID-19 and eye care professionals research focus group study. And it's incredibly telling. We've had a tremendous response. We have really great data from that. It's available on our website, eyecarebusiness.com. If you just go down to our COVID-19 resources page, you'll find all of the research results there. But one of the most telling statistics is that we asked, what kind of financial impact do you expect from this crisis? And 85% of eye care professionals, and we have both opticians and optometrists responding, but it's probably about 80% optometrists and 20% opticians at this stage responding to the surveys, because of changes within the opticals and furloughs and things like that. But 85% said they expect a significant impact to their financial, to their bottom line, which obviously you kind of stopped doing business for quite a bit of time here. So, the thing is now, to dig out and to kind of make that plan. So Tom, I think it's helpful to, there's a lot out there, right? Telemedicine and online sales, and how do I communicate with the patient, and how do I do my website, and how should I do my social media? If you want to boil it down maybe to, what are some key strategies that we can focus on right now? Okay, so do I need to sit down and redo a business plan with all of this in mind and make these are my main points, that I'm going to focus on? What would be your advice and suggestions to help them navigate their course right now?
Yeah, I don't think it's much different than the way I'm thinking about my business. I think we run an amazing parallel, and I would say that if I was thinking on behalf of a doctor inside of a doctor's office, I would focus on 2 or 3 areas immediately. The first would be, what is my strategy? How do I need to refresh my strategy? And that's a really big subject, because sitting underneath strategy is everything from, am I going to use telemedicine or not? What's my flow inside my office going to be? How am I going to, what am I going to do from a staffing, and how am I going to get my staffing back redeployed and re-engaged? And I just, that's a really gigantic subject, but no kidding. That's where I'd be spending all my time is, this is what I was, this is what I'm going to need to be, right? And then you're going to have to organize around that. So I would say my first point is, what's the strategy and how am I going to organize around that? I think the second part to this would be communication. And I think this is where we kind of got our punch in the nose over the last 30 days in a big way. What is our communication strategy with the people who matter? And so for me, the people who matter are my employees, my customers, and my partners. And not everybody's treated the same, right? And they shouldn't be treated the same. And so, in that doctor's office, you've got your patient, you've got your employees, and you've got your partners. And how do I make sure that I am just doing everything I can do to make sure that I'm the best employer, doing the right things for my employees so they're coming in motivated so they can take care of my patients? And how do I make sure my patient outreach is better now than it's ever been, so my patients know they got a benefit coming up that they could use, or they know they need an eye exam, or they know that they've got some contact lenses that that maybe they haven't filled, or that there's this new promotion on spectacles, or again, this, I don't know exactly what that is for each office, but communication, I think, is absolutely foundational to when we reopen. So strategy, communication, and then I would just say execution. We're not going to be perfect, and I use this term a lot, which is say what you're going to do and do it, and then fail fast, right? if you're going to make a mistake, if you can't do it great, I'll give an example of failing fast. I was going to bring the resource center, and I was going to make it a subscription model, and I was going to, because we're in a very low margin business. And so this resource center was going to be this new thing where we could bring all these doctors together. And we were getting ready. If Vision Expo East happened, that would have been the launch. And frankly, it would have been the wrong thing to do. That at this stage, we had to bring it at no cost. And we had to bring, and hopefully, you get the benefit out of getting some revenue later. But we had to bring this at no cost. And so we darn well failed fast. And we pivoted quick, and we changed. And I think the new normal is going to be, we don't know what we don't know. And that we better be willing to say what we're going to do. And then if it's not right, pivot out of it. And so I guess that's how I'd answer that.
I think that's a great perspective. And I think, what we've been kind of talking to folks about, and it's like you said, you got to be ready to fail fast and kind of move to the next thing. It's not going to be pretty, it's going to be messy, and you just got to move forward and try your best shot, and then kind of, refine as you go. Right. Yeah. This is a shoot from the hip situation. Yeah. Nobody's dealt with this before.
Yeah, I think you're exactly right. Although I will say that, again, being new in the industry, one thing that's very different in this industry that exists in other industries is some real fact-based data analytics. Right now we're a very emotional industry. I don't need to do telemedicine. Or, yeah, I'll get to patient outreach later. Or, I don't need that because I'm into healthcare. Well, now that's changed. And I think the opportunity around data and analytics and facts to help us with our decisions are going to be really prevalent now when we reopen. We're not going to just feel good about our decisions anymore, because that just bit us, right? Those feel goods now, literally in a moment's notice, we watched our patients go somewhere else in a moment's notice, right? And so I do think data is going to be a big part of it as well.
It's a great point, no doubt. So I'm just going to give a couple of shout outs to our readers that are commenting over here. We have Anisha Patel, an optometrist, says she loves ABB. We have Ojeki from Nigeria. He says, all fingers crossed, we are all grounded out here, though trying to keep busy. This helps a whole lot. Thank you. We're glad that you're joining. We have another question from our friend Elise Briscoe, the optometrist. She says, Tom, do you think that online refractions and that was her old one, but did we kind of address that, telehealth? And then in terms of online refractions, and, we're seeing so much of this just from our angle on Eye Care Business, different places introducing these online refractions, and, even more prevalent than it was before. Do you think that we'll see consumers shifting to that, or, and obviously that's why it's so important for the OD to communicate right now with the patient to make sure that they understand there are safety protocols in place. It's safe to come into the office. They don't need to go online.
Yeah, I do. I think so. I jumped away from this, and I apologize. I scattered away from the answer to this. We will have an online refraction option for the doctors very soon. And the answer for that, the reason for that is because it's going to be required. That the patients are going to look for us to do stuff in between their normal visits, and we're going to have to provide that on behalf of the doctors. And we recognize that at ABB, and I've got a whole team of people where we've looked at literally probably 8 or 10 different companies to either buy, build, or joint venture with. And we're really close to landing on one. And I do believe that we're all going to have to make some of those decisions, whether it's with ABB or not with ABB. So I do think you're going to have to think like that. And then back to your telehealth question, telehealth is such an interesting such an interesting term, because telehealth could be as scientific or as complicated as this massive, opportunity to do online refractions, or maybe even try on spectacles, virtually, to something as simple as a discussion, right? A Facebook discussion. I just recently had a telehealth exam with my primary care physician, and it was amazing, right? It worked fantastic. And so it comes back to communication, Aaron. It comes back to what's your strategy going to be, and how are you going to communicate, and how are you going to give your patients what they want, which is they want you to be their healthcare provider. They want the ease of doing it. They want to stay safe and healthy. And a lot of times they might want to do it out of the comfort of their own home and then ship directly to their own home. And those are the things we got to figure out, right? That's the quest that I've got a big, huge marketing team that's amazing, doing a lot of work on every day, all day, that you're starting to feel some of that coming out. So, so telehealth is a really broad brush, but it's coming.
No doubt. And I'm sure we'll see a lot of consumer mindset changes in regards to eye care and eyewear as we move forward. So it is so important to stay in tune with that and to follow that lead, with what the consumer wants, because that's going to drive business wherever they go.
Yep.
So we also have a comment from Carla, the optician in France. She says, in France, the businesses are still closed. Since the 18th of March, ophthalmologists are obliged to work only for emergencies. The more important thing is not to be closed from patients, even to take the PD. The danger is still here with COVID-19. The virus floats in the air, and if the practice or the patient has coronavirus, take care. So it's definitely, we're hearing from our readers, and in our surveys, we get a lot of great comments about, what are those changes going to be in terms of everyone wearing PPE in the office? And I know that a lot of the companies are now selling the shields for the slit lamps so that you can give the exam, but still be obviously separated from the patient. So what do you think about that, Tom, in terms of, what's that going to look like? Are we going to have kind of a one in, one out type of policy for patients? What are some of those changes for the new normal that could look like?
Yeah, this is that process flow, that logistics flow of the offices that I think is going to be really challenging. So I think there's a couple of things that are going to happen. First off, I think scheduling and appointments are going to be really important. I'm sure people aren't going to want to be hanging around the offices, and depending on what that setup is, but I think that the doctors and the patients likely will be back wearing some PPE. Sounds like we got some folks from some other countries here. The firsthand experience that they're seeing is that the doctors are coming in with masks now, and the patients are in some areas they're being tested from a temperature standpoint before they even enter the practice. And while that probably felt really intrusive at the beginning, in order to protect them and make sure that they and their families are safe, it became overwhelmingly accepted. Even in our facilities today, we temperature check folks down when they come in, just so we can make sure that we can remain healthy and safe. So I'm sure each office is going to have to take these CDC guidelines. I'm sure they're going to have to make some of their own decisions based on their own logistics and their own facilities. But we should count on PPE being a thing. We should count on temperature checks probably end up being a thing. We should count on flow of your office is going to really dictate and determine if patients are going to come in there. Whether you have a direct-to-consumer model is really going to matter. They might want to come in once, but they don't want to come in twice, right? And so those are the kind of things that we're going to have to develop together, that you're going to have to develop. And then just a quick side note, we're doing a lot of work on PPE. We've got, we probably have 20 companies we're talking to right now, trying to figure out what's the right company, what's the right product at the right price to put our name on and wrap around, bring into the market on behalf of the IECPs. And whether we end up being the distributor for that or a liaison to that will remain to be seen. But we know that ABB needs a solution that we need to bring to the market on behalf of the doctors. But you're going to get inundated with solutions, you're going to get inundated with different companies that want to gown you and mask you and, sell you thermometers, and you're going to need them, but you also got to figure out, okay, how do I be not penny wise, pound foolish here?
Very good point. And I think in this very moment on our panel last week, all of the attendees, our panelists said they were having trouble getting PPE in this moment. Certainly there will come a time when there's an overflow of that for offices. But one of our panelists who has 50 employees, he said that he went to his embroiderer in Pennsylvania, his local person that does his embroidery, and said, "Can you make me matte cloth masks for all my employees?" So, it's some folks are just having to get creative until that PPE is available to them, for properly. But I do know a lot of folks are really, wanting that and looking for that. We have a lot more comments here from people coming in. So we have another question. So Miguel Angel Pinzon, who's we mentioned earlier, thank you for joining us. As part of an essential business, I thank you and ABB for continuing to provide the services you provide. How do you envision ABB adapting to some of the challenges presented during these times, such as working from home, social distancing, etc.? So how are you adapting at ABB? And then maybe, I don't know if you're providing some different solutions or suggestions for customers as well. That sounds like that question is really specific to how do you envision ABB adapting to some of the challenges?
Yeah. So I got to throw a quick shout out here. I see Gary Friedman on from Marblehead, who's my doctor, Aaron. So how do I not?
Yeah. Both your mom and your doctor are on. That's pretty great.
I didn't plan either one of those. I didn't plan. So that's a tribute to you and your organization, right? So anyway, so let me tell you about ABB, and then I do think though that this is an interesting, as you build out your strategies. Hopefully this will be helpful. And of course, we've got an amazing sales team that you can bring some of these questions to and help figure out what we did and to use our experiences to help you with what you're going to run into. So I'll offer that. So ABB is almost entirely work from home today, except for our warehouses. So everything is operational across the country. All of our warehouses are operational, but we have virtually 100%, unless you're a warehouse employee, we have stopped access to any of the buildings. And if you access the buildings, we've stopped any third-party access into the building, whether it's food deliveries or that type of thing. We're in a virtual mode right now. And I'll tell you, I'm blown away at how good this is working. I really am, frankly, blown away. I'm running a pretty big business, and I was really concerned. But there are some common themes here, which is people really care and people really do step up. And if you're founded on trust and you really believe in people and you trust them and you empower them, they'll do amazing work. And this ABB team, and I'm sure many of your teams that are doing stuff virtual, you'd all agree with me that I'm blown away with how great people are and how hardworking they are and how much they care and how much they step up when they need to step up. And then, of course, our warehouse men and women, they're essential, and we got to protect them, and we got to make sure that when they go in there, they're not getting sick, and they may not want to be there. They may want to be home with their families, but they're out there working hard to provide this product out to the world that needs it. And we should never forget that we should be really grateful for those men and women who have to work that may not want to be working today. And we've got a lot of folks that fall into that category. And then of course, I'll say one other thing, which is, alongside that, when you do temperature checks, so we have a nurse on staff, so we're bringing nurse practitioners and nurses on staff. So we've really gone to extremes here to make sure of the safety of our employees. And when you come across anyone that either is ill or maybe even the worst case has COVID, right? What you have to do around the the whole CDC guidelines and what you have to do to remain operational is a really tricky thing. Imagine this: if you're a doctor and one of your employees who has been seeing patients now has COVID, right? Don't underestimate. There's people on this call that are going to have to deal with that. And what are you going to do? What's the CD guidelines? Who are the companies that you're going to embrace? How are you going to ensure cleanliness? What are you going to do for testing and the virus in your facility? Who do you have to contact and how do you have to contact them? And I mean, it goes on and on and on and on. And while, we've had to deal with that on a couple of occasions over the last 30 or 45 days. Again, I'm so proud of the industry experts, and I'm so proud of the experts around disease control, and I'm so proud of our employees. And you figure it out, and you handle it, and you move on, and so your business stays operational, right? But it's tricky, and we shouldn't underestimate that. So that's what ABB is doing today, and I try to transition it over maybe how you should be thinking about it. But I think both are things you should all be thinking about here every day.
Definitely. So, and is that also in play in the in your lab? So you've got, kind of social distancing, no third party entry. Are they wearing any kind of PPE or masks or things like that?
They are. Yep. So
yeah.
we get social distancing. Of course, we test them coming in. We've got them knowing within 6 feet of each other. They're wearing PPE. And of course, any hint of any kind of, a cold or illness, we're really encourage them to stay away. And so far, we're doing pretty well with it.
That's great. How many employees do you have, or how many folks work for ABB currently at the warehouses? And must be quite a few between the warehouses and the lab.
Yeah, we've got about 14 to 1,500 employees normally, and probably got 500 or 600 now across the country that are active.
Right. So that's a lot of people to make sure to care for. Great. Well, I'm going to just give a couple more shout outs, and then I'm going to head back to a couple of our questions. We've got so many folks on here, so thank you all for joining us. We're thrilled to have you here. So we have Jim Trick. It says, hi to Tom from Gary at Marblehead Opticians. Is that your doctor? And then we also have another optometrist from Nigeria, Chara Adekunle, if I get that right. Thank you for joining us. And then Kevin Montone, viewing from Summers Point. We also have Stuart Ginsburg, Dr. Stuart Ginsburg, joining us. Thanks for coming. And then we have a hello from Naomi Knoller. She's an OD on Sawmill River Road in Hawthorne, New York, immediate neighbor to ABB in Westchester. Thank you for all you are doing to help us at this time. So that's a wonderful, wonderful thing to say. Thank you, Naomi. We also have Sanjay Malhotra from India. So thank you. I mean, it's so cool to have such a global audience because this is such a global problem. I'm going to go back to a question that we got from Elise, another question from Elise Briscoe. Dr. Elise says, how do we thrive financially and grow our practices when reimbursement for exams hasn't really increased in the past 30 years? Exam fees and dispensing fees paid by insurance haven't even kept up with inflation. So that is challenging. And I've been speaking, with a lot of our panelists have been saying they're trying to get on to different boards and different things with insurance, because obviously in Medicare boards, because of all of the unemployment and the issues that are gonna manifest in these coming days, folks won't be having quite as much money and be leaning more on insurance or Medicaid, Medicare going forward. So what do you think about that, Tom? And how can you grow a practice, especially in this environment when reimbursements for exams haven't really increased?
This comes back to me to, we need to put a spotlight on this as healthcare, and that we should never forget that it starts with that exam. And that, one of the things that kills me about, again, I'll say this 2 years into the business, it kills me that the financial, health of the doctor is so dependent on what they really didn't sign up for, which is running a business. They signed up because they cared about patients' eyes, and they signed up for this when they were going to school and working hard. They signed up for this because there was a higher purpose, or because there was some kind of connectivity to providing, giving the gift of sight and providing healthcare. And now they've found themselves running businesses with no resources. And so much of their income and so much of this is determined, their success is determined on their front store, not their healthcare in so many ways. And And that just drives me. It's such a pet peeve for me. And it's one of the reasons why the hair on the back of my neck stands up when people start to steal those patients, right? When someone tries to take that patient and take that small little amount of money you make anyway in providing that contact lens or that spectacle or inside your office, and that walks away. But yet everyone in the world says, oh, but the IECP is so important to us. And that IECP, man, we got to go support that IECP. I'm so sick and tired of that discussion unless you put your money where your mouth is like we are. And the concept of saying you support the IECP is one thing, but doing it is a very different thing. And so I'm going to answer this question in a roundabout way by saying, unfortunately, in today's world, the healthcare exam does not pay more than it did. You guys know the stats better than I do, and that you have to run your business the most effective way. And I think that hopefully the front end of that can get fixed, and that's probably not something that I'm going to be able to immediately fix. But the back end, also, you need help. You need those resources. You need to focus on, that P&L and that balance sheet. All that working capital that you all have across the country tied up in spectacles is terrible, right? All that work you're trying to do one office at a time to be profitable is terrible. Your patient outreach, you can't go develop patient outreach programs or web solutions one office at a time. That's terrible because that's all infrastructure that costs money. And so I would say find a friend that can help you do that. Don't be penny wise and pound foolish, right? Build out your front office and continue to beat the drum around this is healthcare with your patients, and then we need to, as an industry, beat the drum on this is healthcare. I actually envision, I'd love eye care businesses supporting this. I think we ought to go write an article talking about you need your community doctor. You need to support your doctor more than ever. They need you, but you need them, and that this is healthcare. That going, Facebook, we're on Facebook Live. I was on Facebook 2 nights ago, and just hundreds of comments from someone posted something with a new pair of spectacles and talked about how beautiful they looked, and they did. She looked stunning, and talked about how they got it from an online company, and it just made me want to cry. Right? So, we're gonna have to fix the back office, fix the front office. Make sure you can make money on the business side of this, and you need the resources to make money on the business side of this. And frankly, I'm gonna stereotype here, but you're not all great business people. You're great doctors, and that sometimes the business side of this really needs some work. And I would just please go focus on that, because that's where you're gonna financially right now, unfortunately, benefit. And then alongside this, the concept of the healthcare, man, oh man, we got to change it. It's the only crazy industry. You get paid more on selling a pair of contact lenses or box of contact lenses than you do, making sure that I don't have, some disease in my body here. So anyway, I'd love to beat that drum.
Well, all very good points. And definitely, I know that the online folks have put a lot of marketing dollars into this time because they're seeing it as an opportunity. The Warby Parkers and Zenni Opticals of the world are seeing it as an opportunity to increase their market share. I mean, they're still only at about 6% these days, according to the Vision Council of RX eyewear sales. But it still is, an issue to beat back, no doubt. And this time is going to make it a little bit more challenging. So
just
we have.
Dude, if you don't mind, I got to say, they do great work. When I think about the companies you just mentioned and others, they have their niche. They do great work. There is a need for them, but there is a need for them. And they do amazing things. And this isn't a negative towards them. The business you're all in and I'm in is supporting that patient in your office. And so, we just need to make sure we give that patient what they want, which is convenience and great product at a great price. But the other thing is that these other companies need you. I say all the time, what you have that they don't is you are the doctor. You have the prescription. You have the patient, and then they're leaving you. This is what we got to stop. We got to intercept that right at the point of healthcare, and we got to stop that. Because without you, those other companies aren't even in business. Anyway, sorry, a little passion behind that.
Yeah, I love it. No, well, and there's a reason that Warby Parker keeps launching brick and mortar stores, and there's a reason that Warby Parker has made such an outreach to our industry to hire quality optometrists because they realize that that is the case. And Warby, I'm just mentioning those few folks, but and they're all good folks, and they're all trying to do good for eye care, but they are the independent OD's competitor, for sure. And we want to make sure that we maintain the quality of care, for sure, across the board for all consumers. So on this note, Dr. Gary Kirschner has a question. He says, if you provide online refraction, where will the patient go to get their glasses? I know you had mentioned ABB was going to be providing some type of online refraction tool. So where will they go to get their glasses? Don't we risk losing the eyeglass sale to the Warby Parkers of the world? And that question's from Gary Kirschner, an optometrist.
Yeah, so that's why we're still researching and not launch. It's one of the reasons why. And there is a lot of virtual opportunities for you all to use. We got to figure out which is the right one at the right cost that can keep that patient in the right seat. And there's virtual opportunities for a concierge service where a patient can go on, they can use telemedicine, they can use refraction, they can try on the glass virtually, and then we could literally ship it directly to the house, right? That's there. That option's there. The question is, how do we wrap it in a bow and how do we get it to you guys? And what's the right company to do it with? And do you build a joint venture in that solution? And those are all the things that, that we've got just a ton of great people working on every day for us, because we realize that you need this, but we realize it isn't just about the online refraction right now. This comes back to your healthcare question around, you don't get funded for, the right front end visit. And so we know whatever solution ABB brings to the market, it has to bring you into it, and it has to follow that patient all the way to that end sale.
That's great. Thanks for filling us in on that, Tom. I'm going to give a couple more shout outs because we have just so many comments. Hello from Dr. Flo Bejian from Chelmsford, Massachusetts. Hi, Flo. Thanks for joining us.
My name.
Yes, and we have a comment from Dave Rossello. This was back a few minutes ago, but he said, so well said, Tom. Really got to keep perspective with all of this. We have Jamie Jameson from New Hampshire. And we have Helen Yun visiting with us. So I'm gonna tip back to a question here that we got from India, from an optometrist in India, Tom. He says, I have a question, and I think this is a very good question because we've been wondering about this ourselves. He says, will there be a pent-up sale once we open, which means that for some days we will have good sales. So once everybody's open, people are able to go back out and do their thing. Are they going to be, will we see a spike in sales?
Yeah. So based on what's happened in some of the other countries and some of the intelligence that we're working on trying to get out in front of here, I do believe there's a pent up demand for the spectacles, right? I do believe that will come back quicker than the contact lens business. I also believe that early on, there's a lot of patients that bought their contact lenses early from you. And because we saw a spike, the first 2 weeks of this, we saw a huge spike in sales and then a huge drop off. So we believe that there was some pre-buying done, right? So there was some buying in excess done. But what I'm worried about is, again, through some intelligence, a lot of these other companies, these online companies and other companies are seeing, greater than 100% growth in their businesses, and that's sustaining itself over time. So when you come back, I would predict, we are building our business models at ABB predicting, and again, I hope I'm conservative or even wrong in this statement, but I can tell you how we're thinking about it. We're thinking that we could easily lose 10 to 20% of the contact lens business we had in the United States, which means you're going to lose 10 to 20% of your business if I own the majority of that market share. We believe that the spectacle business and the contact lens business will come back slower. So it's going to take 2 or 3 months for it to get back to its normal run rate. You know, and then, like I said, even be probably 10 or 20% lower than where it was. We do believe, though, that the lab business, the spectacle business, will rebound quicker. So that might take 30 to 45 days, but we believe there is some pent-up demand there. Less options online, right? I mean, frankly, that's the reason why. And it's actually what's happened in a lot of other countries as well. And so the watch out for all of you and the watch out for me is, how do we know which patients left us and went somewhere else? How do we go back after them? How do we make sure we provide them with a solution that really reinforces that you're their doctor and that you should be treating them and that they need you and you need them? And alongside of it, try to grab them back at the point of the exam. So that's the way we're thinking about it at ABB.
That's great. Well, thanks for that perspective. We're just getting more and more comments, which is fantastic. We have Pam Kazmarek says, kudos to ABB for the free shipping on 2 boxes of contacts direct to patient. It has worked exceptionally well for our small franchise in Virginia Beach during this very, all capital letters, slow time. How long do you see this benefit continuing?
Yeah, that's a great question. I'm going to answer it in a funny way. So the first thing I'm going to say is that we with the support of our vendors, brought that product to market. So all of our vendors supported that ask when we brought it to them in order to help the doctors. And so most of this funding is coming from ABB in the other 4 contact lens manufacturers today, and they are great partners of ours. If that dries up and that doesn't happen, and we anticipate at some point, to some degree, it is going to dry up and that funding is going to go away. My team is actively working on today, what's the solution to that? And so we might ask you to do things a little bit differently in order to continue to provide that solution going down the road. An example of that is we ship everything next day, pretty much everything next day. Maybe we'd set it up that we ship everything 2 or 3 days, right? But we give direct to patient next day free of charge. So if it's coming to your office, you might have to wait another day or 2. But if it's going direct to the patient, it'll go out free of charge, immediately. So I'm not suggesting that's what we're doing, but we're looking at the inefficiencies in the system to provide you efficiencies when this thing dries up going down the road. And I would fully anticipate we're going to feel pressure and that option of free freight is going to go away. But I'll tell you, one of the things I can commit to is really, really working hard with these 4 vendors to emphasize the importance of this. Really working hard with these 4 vendors to try to get them to help fund that with us, and really working. And they've been great. And so I'm not going to say that it's going to go away, because it might not. There's great value. Think about this. We've set up 2,200 web stores in the last 30 days, 2,200 offices across the United States, web stores, and shipped 500,000 direct-to-patient shipments. That's a big deal. And I think, if I were one of the 4 manufacturers, I would much rather this be going through the doctor than I would the online. Now, even though they're getting credit no matter what, they're still getting the sale, right? But if you're shipping it through the doctor and you're shipping it through it, your distributor, your wholesaler, you know exactly where it's going, and you're not worrying about them converting to their private label product, and you have great access to data and analytics, and there's a huge value to distribution. And so I hope that we're successful in our negotiations to continue with this. But if it doesn't, know that it's we're laser focused on this to try to bring this to market as a solution for you, so we can continue to do it, so you can stay competitive with who your disruptors are.
That's great. I need every kind of advantage that you can get at this stage, for sure. We have a couple more kind of folks popping in. I'm not sure if I called out yet to Jamie Jameson from New Hampshire, but thanks for joining us. And then we have, and Brian Schuller says, great job, Tom, great passion and insight. We also had a thank you from Sanjay from India. Great, thanks, Tom, who I think you had just answered his question. And then we have another question here from Justin Tense. So, and this is something you kind of addressed a little bit earlier, Tom, but maybe I don't know if you have a time frame on this. He says small independent ECPs are having issues finding reliable sourcing on necessary PPE and disinfectants to prepare for the reopening of our practices. And that's something I mentioned before. We've been hearing a lot from our readers and our panelists in this strategy session. Is that something ABB with their resources can help with? I know you mentioned earlier you were looking into that. Do you have a timeline on that?
Yeah, so we'll have an announcement on that imminently. One of the things, of course, I'll put a plug in for my old employer. I worked for 35 years at Cardinal Health and ran a lot of their business, including at one point their manufacturing business. And they're an amazing organization that's doing some amazing things inside healthcare, and they do a lot of manufacturing of PPE. And so we're talking to companies like Cardinal Health. We're talking to companies like McKesson. I've got great friends over there, and they've got amazing manufacturing and resources around PPE, along with a lot of other folks inside the industry here that are bringing PPE to the market. And we could have PPE in our warehouses right now, but the problem is here's what we're looking for: best product at the best price with a reliable source, that we're not just going to be bringing product to the market and then falling off and bringing product. We got to know that we've got enough product to handle this market at the right price, for the doctors, so they know they can be consistent in their practices. And so I would say, if Erica was on this call with me, she'd say that, we're knocking at the door. We'll have a decision on this imminently. Frankly, we're trying to decide, do I want to be in the distribution business of PPE, or do I want to just be a liaison for you in that? And that's coming. So I would say, hold on another week or two, and we'll have some much clearer definition around that.
That's great. Thanks for letting everybody know. I know that's a definite need right now. We have a couple other comments, and I know we're running a little bit over, so I think we're kind of almost through our questions, and then I'll ask you at the end, Tom, if there's anything else you want to cover or add, but I'll just run through these real quick. We have Tommy Lynn says, excellent job of sharing the message of ABB. Private practice must band together if we are to survive and thrive. Us private ODs must realize we can't do it alone. We need ABB to lead the recovery. A very nice comment, and thanks for joining us, Tommy. We appreciate it. We have a question from Helen, and this is kind of a little bit specific, so I'll just throw it out there, and I'll mention that we've had some other panelists address this, but she has a patient who has VSP. He can't see without glasses. If I see him today and bill VSP, will they reimburse me for an appointment right now? So I don't know if that's considered an emergency care situation, but we have had this comment in other panels that we've talked through different panelists. Do you have any knowledge there, Tom? And
I don't. I don't. VSP, of course, has been another good partner of ours, and I'm sure if we, either reach out to our rep or reach out to VSP, I'm sure they'll field this question for you. I'm sure they'll, now more than ever, I think all companies. What I love is all companies. I shouldn't say all companies, that's probably not accurate, but so many companies are stepping up in ways that they had never stepped up in the past. ABB's one of them. I think VSP's one of them. There's a lot of them out there. And so I would say, rather than me trying to put words in their mouth or try to guess on how they'd want to handle that, if we can help you, let us know, or otherwise I'd try to get in and see if you can get someone to help you answer that.
That's great. Great advice. And Helen says, thank you. And Stuart says, providing access to PPE would be another feather in the marvelous cap of ABB. So that's really nice to have said. And then I have one more question I'll address here. Naomi Noller says, how will we clean the frames after a patient tries them on? We do actually have a frame disinfection guide on eyecarebusiness.com. Right at the top of our homepage, you'll see it in the slideshow as it passes through, and you can click through and there's a guide to disinfecting frames. I don't know if you have anything to add there, Tom, or if you guys will have any products on that front as well.
Yeah, I do think it's going to be important that you have a disinfecting strategy. I also think it's important, again, I'm going to sell futures here, but we'll be coming out with a frames lens package, that a lot of companies have done that at this stage, but We're working really hard to come out with one so we can eliminate. Talk about, someone asked earlier about freight. Can you imagine if we can stop all this nonsense of taking your, frame that you've already spent tons of money, you got capital sitting in your facility, right? Then you take it off your board, then you ship it to me and pay UPS or FedEx to do that. Then I take it and ship it back to you, and then you got to give it to your patient. We got to just get rid of all that. We got to be much more effective in our frame lens distribution. So you have that one frame that's always on the board, not gone once someone buys it from you, or not gone and you got to go find it in another drawer, right? And you don't have to sit on $250,000 or $100,000 worth of frames in your facilities. I mean, those are all things that are killing you guys that we've allowed to happen in this crazy business. And so, while, we're going to probably only be able to handle a small portion of this, we will have a frames lens package where, hopefully, you can disinfect that one you have on a regular and a routine basis. But when I come in and I say, boy, I really like that, you hit a button and we are manufacturing it and shipping it direct to that patient's house. So they're getting service better than anybody else in the industry, right? That's the plan going forward. And we're not that far away. We opened our Kentucky lab recently, and it's brand new digital lab, state of the art, with technologies in there that don't exist in a lot of labs throughout the country. And teams working really hard to come up with a solution there.
That's great. Well, thank you for that. And we had a great comment from Steve Rose to Helen to answer her question. And Helen says, thank you. She appreciates it. And Steve says, this is Steve Rose from ABB Labs. Please reach out to me and I can help you with your VSP question. He provided his contact info. So this is
Steve, what I'm doing for you.
This is great. I love it. Problems and solution in action right here. We had one more comment from Jerome Hernandez. He says, if the manufacturers have any new products in the pipeline that they can accelerate, they normally release them to private practices first. That would be a way to temper the loss of online distributors for a while. So that's a great insight. So Tom, I thank you so much, because we've gone, way over here, from what we anticipated, but we have had such great response and tremendous attendance. So we thank all of our attendees. Tom, is there anything you want to add, or any kind of, information or insight, you'd like to share with folks, or last bit of advice for our viewers?
Yeah. So I guess I said this earlier, and I maybe want to double click on it, is that the last 30 days or the last 40 days have been terrible, and it's so sad. And I'm so sorry for, our business, but I'm more sorry for the world, and I'm more sorry for, the poor people who are losing loved ones to this terrible virus. And that, and yes, this has punched us in the face as a business, and you as well. But there's no doubt in my mind that we're coming out on the other side of this relatively soon and stronger. And that there's going to be winners and losers, and that the winners are going to be the ones that embrace change. The winners are going to be ones that find a friend and commit to great execution around that strategy. And the winners are going to be the ones that aren't victims. We can sit and be victims now, or we can be change agents. And I want to be that change agent. You need to be that change agent. And if we go after this with a positive attitude, and we go after this really convicted in the fact that this is healthcare, and that we have a higher purpose in what we do, and that you really do matter, and that this is no one else's patient but yours. And at the end of the day, everyone in the world can try to come after them and steal them from you. But that doesn't matter. If we do the right communication, if we have the right programs and the right services, it's your patient right from the point of exam. And those will be the winners, right? So if you change along here, and that we're not victims, but we really go after this with, we're gonna have to do things differently. But if we do that, there's no doubt in my mind we'll win. There's no doubt in my mind we'll be strong at the other side of this. And I'm just telling you that ABB is going to work hard. I'm not going to be perfect. I'm sure we're going to fail a lot of ways, but I'm going to promise you we're going to fail fast. But I'm going to promise you we're going to work really hard.
That's fantastic. Well, great perspective and great inspiration. I think, this has given a lot of folks a lot to lean on and to go forward with. So I really appreciate you joining us. It's such a wealth of insight and knowledge. So thank you so much, Tom. We really appreciate it. And thank you to all of our viewers and readers and folks that have tuned in today, and for all your comments. We're just so thrilled. We're getting a lot of Nate Agora. Hi, Nate. Nate's going to be on our panel on Wednesday. He's an optician and business owner in the US. And Dave Rossello says, thanks again for your time. We've just had so many great comments. So thank you, Tom, and thank you all our viewers. We really appreciate it.
Yeah. Hey, Erin, and no one thanks you, right? And so I just want to thank, really, but you do, it's amazing, right? It's amazing work. And, you guys are just such an amazing publication and business. And thanks for doing this for the industry. It's been really fun.
Well, it is my honor. And it's, what we're passionate about at Eye Care Business is helping people run the business part of their practice, which obviously, is ever more critical in this time. So it's our honor to help out and to provide information and resources for folks. So thank you for saying that. Cheers. And we appreciate you joining us. And I look forward to the next time. This was great.
Thank you.
All right. Thank you, guys. And join us on Wednesday. We're going to have another panel of independent optician owners. Some fantastic folks. Nate Agora, who's here, Sheena Taff, Jonah Dukes, and Ryan from Specs by Ryan. So that's at 12:30 Eastern time, right here on our Facebook page, Facebook Live. And we're doing that every Wednesday and some other days as well. So keep joining us, and we'll look forward to helping you out. Thank you. Take care.